Hello, this is Dr. Miriam Martin with your medical message for today, and I will be discussing influenza because it is what? Flu season. So, influenza, commonly known as the flu, is a contagious respiratory illness caused by the influenza viruses. It infects the nose, throat, and even sometimes the lungs. According to the World Health Organization, seasonal influenza affects approximately 5 to 10% of adults and 20 to 30% of children worldwide each year, resulting in an estimated 290,000 to 650,000 respiratory-related deaths globally. The virus spreads primarily through droplets generated when infected individuals cough, sneeze, or talk, and it also can survive on surfaces for a limited time, aiding in transmission. So recognizing the symptoms early is crucial, and these typically include sudden onset of high fever, chills, muscle aches, fatigue, cough, sore throat, nasal congestion. Then this can really impair daily activities. The diagnosis of the flu is primarily clinical, based on history and presentation during peak flu seasons. However, there's laboratory testing such as rapid influenza diagnostic tests and PCR and viral cultures, which can confirm infection and differentiate between influenza A and B. Timely diagnosis is essential, especially because flu symptoms often overlap with other respiratory illnesses, and early identification can guide appropriate treatment strategies. Okay? And these medications that are used may be most effective when administered within the first 2 days of onset of symptoms. So this is emphasizing the need for prompt medical attention. So the treatment involves both pharmacologic and supportive measures. We have antiviral drugs, such as Tamiflu, and that can actually shorten the duration of your illness and reduce complication risks. This is particularly important in the elderly, pregnant women, and those with chronic health conditions. Flu is no joke. Supportive care, rest, hydrate, over-the-counter medications to alleviate symptoms like fever and body aches is important. Vaccination remains the cornerstone of prevention, with annual flu shots. It significantly reduces the incidence and the severity of the illness. So if you happen to contract flu, the severity may not be as bad if you've been vaccinated. So public health efforts focusing on vaccination, good hygiene practices, wash your hands, cover your mouth, and early treatment are vital in controlling influenza's impact on communities worldwide. 3 John 1 and 2 lets us know that it is God's desire that we prosper, be in good health, even as our souls prosper. So during this flu season, use wisdom, get vaccinated, cover your mouth, wash your hands, and early treatment is essential. Once again, this is Dr. Miriam Martin with your medical message for today. God bless.